Everyone doing today? It's Dr. Nicole, your board certified family physician, and we are going to complete Wellness Week today, and we're going to talk about seniors and adult wellness exams and what goes on during a wellness exam. Okay, so I'm going to wait for just a few more moments to let some folks join in. So while we're waiting, I remember one of the things I love about seniors, especially people like my grandmother, God rest her soul, she's been gone about 10 years now, but they always had a song to sing, and I loved that about my grandmother, and didn't have like the prettiest voice, but she always loved to sing, and she would sing those old songs that would just really get down into your soul and just really encourage you. One of the ones I remember, she would say, I feel like going on, I feel like going on, though trials come on every hand, I feel like going on. And then she say, I feel like pressing my way, I feel like pressing my way, though trials come on every hand, I feel like pressing my way. Just wait a few more moments, let some more people join in. One more time. I feel like going on. Hey Tanya, thanks for joining in. Share this video with your friends. I feel like going on, though trials come on every hand, I feel like going on. Hey Tara, thanks for joining in. I feel like pressing my way. Share this video, please. I feel like pressing my way, though trials come on every hand, I feel like pressing my way. Don't you just love Grandma? I do. Well, like I said, today we're going to talk about wellness exams for seniors and for adults. I am Dr. Nicole, your board certified family physician. I specialize in preventing and treating chronic medical conditions and explaining those conditions to people in everyday terms that they can understand. Through my books, my concierge medical practice, and my seminars, I help pastors, congregations, and everyday people live their best lives by transforming their mind, body, and spirit so that they can be present for their communities, their congregations, and their children, and everyone around them. Please follow me on Facebook, www.facebook.com/Dr. Nicole D.O. That's DRNICOLEDO. So today we're going to talk about wellness exams for adults and for seniors, all right? And when I say adults, I mean our seasoned adults, our adults over in their 50s and 60s, over 65. Everybody should get a wellness exam. Please look at my videos from earlier last week where we talked about wellness exams for everyone. We talked about in general wellness exams. We talked about pediatric wellness exams. We talked about wellness exams for women, wellness exams for men. And later on today, I'll probably come back and we'll talk about wellness exams for teens and adolescents. But today I wanted to talk about wellness exams for adults. Hey, Dr. Witherspoon, thanks for joining in. Dr. Alex, thanks for joining in. Please share this video so that your patients and that your families can understand what wellness exams are too. So wellness exams, again, are exams that we find medical issues and we try to get them before they occur so that we can prevent them. There are three types of wellness exams. There's three types of preventive exams. There's a primary prevention, which are things like immunizations, where we try to eradicate disease before they even occur. By doing things like immunizations for the measles, mumps, and rubella, we can stop the spread of those diseases. As you see, we don't see many cases of those anymore because we've been immunizing people against them. Secondary prevention is where we identify risk factors like blood pressure, diabetes, cervical cancer, prostate cancer. So we identify risk factors and then we prevent those conditions before they occur. All right. And then tertiary, or the third level of preventive care, is where we've already found medical conditions that you may have and we are trying to treat them before they get any worse. All right. So we're preventing them from getting any worse. So three types of wellness exams: primary, things like immunizations to totally eradicate diseases before they occur; secondary, where we identify risk factors and then we prevent those from occurring; and then tertiary, where we find medical conditions that you already have and we prevent them from becoming any worse. So when you become an older adult or a seasoned adult, we like you to have your wellness exams at least annually. So every year, even if you're not sick, especially if you're not sick, we still want you to come in to see your doctor so that you can do your preventive care. And like I said, we do wellness exams to try and prevent medical conditions and live your best life and have your best life possible. Okay, so we want you to come in annually. Now, we don't want you to wait until you have a problem, because like I said, these wellness exams are occurring. Excuse me, I have to find a new spot because my spot has some ants and I'm allergic to ants. So let me find a new spot to go and record from. Y'all watched my video a couple weeks ago about insect bites and what one little ant did to me, and I think an ant just bit me. So hopefully I won't have an allergic reaction to it. All right, let's try and come over here on this side. I am at church today, you all. We have an afternoon service, but I didn't want to leave you guys hanging because I know that I come on every week, every Sunday at 3, so I didn't want to leave you hanging. So I will go back inside service here in a little bit, but let me just find a new spot here so I'm not getting bit by ants, all right? Okay, sorry about that. Okay, so, okay, I'm back. And hopefully I won't react to this ant bite here. Okay, so what was I saying? Oh, don't wait until you have a problem, adults and seniors, before you come in to see us. In fact, your insurance will not want to pay for a wellness exam and a problem visit in the same time. And if you come for both, then we'll have to bill you for both. Okay, so you want to not come with a list of problems, not wait until you have a long list of problems, because that's not what a wellness exam is for. A wellness exam is actually, we have a list of things that we need to do, and we're going to go over those in a moment. And so we're not coming to treat your diabetes and your blood pressure and the pain that you have in your neck and the itching of your skin. And hey, Marshall, thanks for joining in. We are not treating a problem. It's not a problem visit. This is a preventive wellness exam, okay? So that's step number one. Don't wait until you have a problem to come in, because when you come in with problems, then that becomes a problem visit, and that's not a wellness visit, okay? So a wellness visit, what are we going to do at a wellness visit? We're going to go over your history. We're going to make sure that nothing has changed in your history. So we'll go over your past medical history, things that you've had in your past, things that conditions that you've had. And we'll go over your surgical history, if you've had any surgeries or procedures done. Then we'll go over your social history. So we're going to be asking things like about smoking, if you are a smoker, how much are you smoking, when did you start smoking, how many packs per day that you're smoking. Then we're going to talk about things like alcohol, what kind of alcohol and how much alcohol you're consuming. We'll talk about things like diet and exercise and how much exercise you're getting. Then we want to get your medications. We want to know if there's other specialists that you're seeing, or if there's any other doctors that you're seeing that may have prescribed a medication that your primary doctor doesn't know about. We need to get an update of those. Think of your primary doctor as the conductor, all right? So all of your specialists, all of your doctors are part of the symphony that come together to take care of you, and think of your primary doctor as the conductor. All right, that's either your internist or your family doctor. They're the conductor, so they should know what the surgeon is doing. They should know what the gynecologist is doing. They should know what the cardiologist is doing, what the nephrologist, the kidney specialist. So they need to know what all the parts are doing so that they can make sure that everything comes together to work together to get you at your healthiest and your wellness. So if you've got medications from all these different doctors, this is the time where we need to come together and know this. Not only do we need to know about your medications, but we also need to know about any supplements that you're taking. If you're taking ginkgo biloba, if you're taking glucosamine chondroitin, or if you're taking, just a women's wellness, women's once a day, or a men's once a day, or Centrum Silver, just 2 gummy vitamins. We need to know all the vitamins and supplements that you're taking. Also things that, like supplements that you put into smoothies, into your drinks. We need to know about all of those as well. So we're going to go through your history, past medical, past surgical, social history. And in your social history, we're going to ask things about, are you now a grandmother or grandfather? Have you lost anyone in your family? Has anybody passed away? Have you gotten married? Have you had any children? Things like that we're going to discuss at your wellness exam. Then we're going to go over your medications. We're going to make sure that we have all your medications listed correctly, all the supplements that you're taking listed correctly. It would be really good, people, if you can bring your medications with you to the doctor, and that way we can go over them. We can make sure that you don't have any duplicates. We can make sure that there's no medications that would be contraindicated or clashing with each other. I see a lot of times, especially in my seniors, something we call polypharmacy. And polypharmacy is when you're on basically too much medications. I know a lot of people feel like, oh, doctors just want to throw pills at us. Well, not necessarily, especially because doctors, we know that some medications and all medications have side effects. And those side effects can then cause other problems. And so we want to find out if there's any medications that could be making a condition worse. For instance, hey, Dr. Pam, thanks for joining in. I have one pastor who I take care of, and he was on a medication for his blood pressure that actually made his asthma worse. And so when he would preach, hey there, Anitra, thanks for joining in. When he would preach, he would get short of breath and he would get winded really fast. Well, I went through his medications one day and I was able to change that blood pressure medication to something else. Well, guess what that did? That made his asthma a little bit better to control, and so he was not on as many asthma medications. So a lot of times we get polypharmacy, and a lot of times the older we get and the more conditions we get, the more specialists that we see, the more doctors that we see, we have a lot of medications that may be interacting with each other or may be causing some more problems that are not necessary. So we want to bring all your medications so that we can go through your medication list and we can try and pull you off of some of the medications that are not necessary. You'd also be surprised how many times I see some of my elderly patients that come in and they have multiple bottles of the same medication. Well, what does that run a risk of? That runs a risk of taking too much of a medicine. So when your medications, and I tell this to my seniors all the time, when your medications are done, when you're finished with it, throw that empty bottle away. You don't want to keep medication bottles because that can cause a problem, okay? You want to, I tell folks, get one of those containers, one of those pill counter containers, and put your morning pills, your afternoon pills, your PM pills, and that way you can know exactly for the week how many pills you're supposed to be taking, and that way you're not accidentally like, did I take this pill or not? And I don't remember, so then you might take too much. So have a way to store and to organize your medications, all right? So after we go through your history, past medical, past surgical, medication, social history, we're going to do a physical exam, all right? Head to toe physical exam. So we're going to do everything. We're going to check your scalp. A lot of doctors, a lot of times, a lot of patients forget that they need to have their scalps checked. When you're standing in the sun like I am right now, that sun is beating down on your scalp. And especially as we get older, some of the gentlemen and some ladies too that may be having some thinning hair, that sun has basically unopposed rays on your head, and so you can be getting some sunspots or some lesions on your scalp that we need to check out to make sure that there's nothing that needs to be frozen off or shaved off or sent to a dermatologist to taken care of. All right, so we're going to check your scalp, we're going to check your ear, nose, and throat. We're going to we're going to do your eye exam, just a an eye acuity chart. That's, you know, where you get the big E and you got to say the letters. Don't memorize the letters, guys. I know you do that, but don't memorize the letters because you really want to see what your vision is. Really, you should have an eye exam every 1 to 2 years as well, right? So you can make sure we check the backs of your eyes and make sure that there's no diabetes changes or blood pressure changes to the backs or the retina of your eyes, all right? We also want to check for things like cataracts and glaucoma as well. Increased pressure behind the eyes. We want to check for that as we get older because we know that that is a common occurrence as we get older. We're also going to check your heart, your lungs, make sure that you're breathing okay, make sure that you're not having a nighttime cough, make sure that you're not having palpitations or your heart beating funny. We're seeing that as we get older, you can have an increased incidence or increased risk of, hey Tara, thanks for joining in, increased risk of atrial fibrillation where the heart is more quivering, the top portion of the heart quivers instead of actually beats. And as we see that as we get older, we want to check that and find that early, because when the heart is quivering like that and not beating, when it finally does beat, when it's quivering, you can get the blood just sits there and pools there. Hey, Crystal, thanks for joining in. And when it pools, it can get clots in it. And then so when it finally does beat, it can send a clot out and you have an increased risk of heart attack and stroke. So we want to try and prevent that. So we want to listen to you to make sure that there's no atrial fibrillation or irregular heartbeats, all right? We're going to talk about your digestion, make sure that you're not having any constipation, any diarrhea, any loose stools, any change in your bowel or your stool habits. We're going to do a full physical exam, including a rectal exam, and that's for ladies and gentlemen, all right? A rectal exam, for ladies, we do a vaginal exam. For men, we do a penile and testicular exam. We're going to check and make sure that there's no hernias. We're going to check all of your joints, so your shoulders, your elbows, your wrists, your fingers. Make sure that there's no arthritis. You know, the harder we work, the more we use our joints, and the more you use your joints, the higher risk you have of arthritis. We'll do a Facebook Live specifically on the different types of arthritis in the future, but there are multiple types of arthritis, so we want to check and make sure that you're not developing any of those types of arthritis, okay? So check full head to toe exam. We're going to check your sensation, make sure that you can feel, make sure that you don't have any loss of sensation on your feet or on your fingertips, make sure you don't have any carpal tunnel. We're going to check your nerves, make sure you don't have any weakness. Full head to toe exam, all right? And then we're going to do what we call anticipatory guidance. Anticipatory guidance is where we do that's usually that secondary prevention, where we are going to identify risk factors and try and prevent them. All right, sorry about that, guys. All right, new location, hopefully new signal. All right, so anticipatory guidance. We're going to talk about smoking cessation, medications possibly to stop smoking, or other ways that suggestions that we can help you stop smoking. We do know that sometimes it can take up to 7 tries to be successful at successfully quitting smoking. So don't give up. If you are a smoker, don't give up, all right? We will work with you and try and find a way to help you stop smoking. I often tell my patients, when you do successfully stop, take the money that you would have bought cigarettes with and put it in a jar. And at the end of the year, take that money and take yourself on a vacation, all right? That's a great incentive to stop smoking and save a lot of money, all right? So other things that we do in terms of anticipatory guidance, we're going to stop alcohol. We're going to discuss sexual habits. And even in my seniors, I do encourage the use of safe sex, because just because you can't get pregnant doesn't mean that there's other diseases and things that can be passed along. We do see an increased incidence of sexually transmitted infections in our older population, a lot of times because they're not practicing safe sex, because they feel like because they can't get pregnant, they don't have to. So I encourage my seniors and my older adults, please practice safe sex, all right? Either abstinence or use condoms or other barrier methods so that you are not passing STDs. All right, so we're also going to discuss things like exercise. How much exercise are you getting? We know that to increase your cardiovascular supply, they recommend 30 minutes a day, 5 days a week. You don't have to get all 30 in at once. If you do 10 minutes here, 10 minutes there, and 10 minutes later on, that'd be great. Things like walking, elliptical machine, things like Zumba class, things like water aerobics. Water aerobics are great, especially if you have problems with your knees, because you're weightless in the water, and so you are still getting a good cardiovascular workout without putting the pressure on your knees. All right, so we're going to talk about your exercise. We're going to talk about diet. Make sure that you're eating a healthy diet and that you are getting the correct amount of nourishment. We'll also talk about, again, any supplements that you're taking. And then we're going to do a depression screen. You see a lot of depression, especially as people get older. They see, you know, their people that they grew up with, their friends are often passing away. Sometimes their spouse could have passed away, or they have to have buried a child or somebody close to them. And because of that, they can get a lot of depression. Also, we see even without death, when people retire, a lot of times that is they can go through a grief process because now they don't have something to do every day. And so there's more sitting around and doing nothing. Well, we know that that can create some depression. And so we do a depression screen to make sure that you're not dealing with any depression, anxiety, or insomnia or problems sleeping. All right, so depression screen, we'll also discuss, like I said, smoking cessation, diet, and exercise, and then any supplements or medications that you're taking. All right, let me just talk about the Welcome to Medicare physical. People didn't know this, and I'll admit, before I learned about this, I didn't know it either, that when you turn 65 and you join Medicare, you get one free wellness exam. It has to occur before you turn 66. So you have exactly 1 year to get this free Welcome to Medicare exam. All right, there is a packet that all right, back one more time. Sorry about that, guys. My church is kind of rural, so